Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is another video about pandas and pans. One of my, I was on one of my other videos. Someone had posted a bunch of questions about pandas and pans, and so in my last video, I started answering some of those questions. So I'm going to bust right back into that list. So there's still quite a few left on here. Um, So the next question is for individuals who are born with pandas or pans, or rather for individuals who develop pandas or pans, were they born with elevated bilirubin levels? I have not seen that to be the case, so I'm not sure if that might apply, but I've never noticed that as a trend. Did they have a bad reaction to the 1-year-old immunizations? Again, haven't really seen a trend with that. Kids who develop pandas and pans are sometimes more reactive to things like medications, supplements, environmental substances, exposures, and whatnot. But I wouldn't say that I've really noticed that as a trend that I've seen in my practice. If Now, with that being said, if someone had a history of reacting to an immunization and then they had symptom they were presenting later on with symptoms that were consistent with pandas or pans, I would be thinking to myself like, oh, they're a more reactive person, they're more prone to inflammation, they're more prone to immune system overstimulation. So I would certainly look at that as being a relevant part of their history to maybe suggest that pandas or pans might be a more likely thing that's going on. And then similar question about bad reactions to a strep pneumonia vaccine. Also have not noticed that as a direct correlation. When a child develops a fever with this infection, does it cross over the blood-brain barrier? So fever is a systemic thing, so it's not something that kind of crosses the blood-brain barrier or not. So it's a good question, but let's see here. Oh, okay. I think I maybe misunderstood the question. I think maybe the question is, if a child has a fever with an infection, does the infection cross over into a blood-brain barrier? That's a very good question, if that's what the question is. I do not believe that fever increases the permeability of the blood-brain barrier. I don't know that to be, I don't know definitively whether that's true. It's not something that I've heard of before, but maybe that is the case. I've never looked into it. It's a very good question. I don't know if that increases predisposition. What I can say is that just historically or clinically, observationally, even based on some limited research trials that I've looked at, fever tends to be something that's associated with better outcomes overall. And sometimes my phone falls off my microphone or my microscope stand. A patient, or not a patient, but somebody who watches a lot of my videos once sent me a little phone holder, which was so kind, and I just never haul it out to use it because I'm always in a rush, but it was such a lovely, lovely gift. But apparently I should start using it. Generally speaking, fever seems to be a helpful part of it's a mechanism that evolutionarily was developed to help us get over infections. Of course, if the fever is too high, or high, especially a prolonged high fever, it can be dangerous. Absolutely, have to it's all relative. But I can't imagine that a fever along with an infection would increase the risk of pandas or pans. But again, I don't know that definitively. It's a very good question. Let's see here. Are individuals with pandas and pans low in vitamin D? Oftentimes, vitamin D is something worth checking with any type of inflammatory condition. To be perfectly frank, we don't really do a whole lot of blood tests on kids because I'm just a big softie and really don't like sticking needles in kids if we don't have to, unless it's like really, really necessary. So in kids, I would generally just supplement them with vitamin D preemptively at safe dosages. But I wouldn't be surprised if there might be some correlation there, but I've never made that observation before. Was the mother given the MMR vaccine during pregnancy? I don't know if that's a correlation or not. Which contains, were mothers given any medications during delivery for induction? I don't know. Very good question. I have no idea whether that would predispose one to pans or pandas later on. I think it'd be a really, really tough thing to track, but it'd be really interesting to know. Also, do these kids have a primary immunodeficiency disorder such as an X-linked recessive inheritance? I do not know. And then I found found that my kids are sensitive to strep A, and kids who have this condition are as well. Yes, a common observation on kids with PANDAS, if they're around more strep, they tend to have flare-ups, which makes sense because it's this autoimmune brain inflammation condition triggered by strep, and so exposure to more strep, including strep toxins, is something that's going to potentially trigger more neuroinflammation and thus cause a flare-up or an exacerbation or a recurrence if a child's in remission. So thank you to the individual who sent all those questions. Very, very thorough list of questions, some really good ones in there. I hope that was helpful information for you. If you or anyone else has any questions about PANDAS or PANS or any other health topic, please feel free to post it in the comment section below, and I will do my best to answer it as soon as I'm able to.